Hi everyone, I'm Dr. Nina. Let's talk about the use of ultrasound in pregnancy. Is it safe or not? It's a very common question many moms to be have, and also their family are very concerned, especially when we ask for repeated ultrasound imaging when it comes to monitoring the baby or for any other purposes. So, ultrasound usage in pregnancy may have to be done frequently, especially when it is associated with any pregnancy complication or when there is a complication of the baby, like a small baby, to assess how big the baby is and the blood flow of the baby, also, especially when associated with any other pre existing high risk factors. It also helps to improve the pregnancy outcome, to increase the survival as well as the live birth rate, to helps to decide upon the timing of delivery as well as the mode of delivery, whether we are safe to go for a vaginal delivery or whether we need to deliver the baby by cesarean section. Coming to the ultrasound usage in pregnancy, it basically uses the high frequency sound waves, which is far beyond the audible capacity. Unlike in case of the CT scan as well as X-ray imaging, where they use the ionizing radiation or the radiation exposure is there to the baby. But in case of ultrasound imaging, it's not a radiation exposure to the baby, so it is safe to be used in pregnancy. And how frequently it should be used, it should be decided by your doctor or the healthcare professional who is taking care of your pregnancy. And is it safe to take more than 3 or 4 ultrasound in pregnancy? Yes, if required to improve the survival of the baby, it can be taken. And how close it can be taken, maybe depending upon the complications, like if it's a very small baby with the blood flow associated problems, it can be even uh, done frequently as like daily or maybe twice daily, but it's perfectly safe in pregnancy. The ultrasound can be of different types like 2D ultrasound, 3D ultrasound, 4D ultrasound, and sometimes even we can do the Doppler ultrasound. That's basically to look at the blood flow to the baby. So 2D ultrasound is perfectly safe in pregnancy, even if we do during the first 3 months of pregnancy, which is the most important time of the organ formation of the baby. But the Doppler ultrasound has to be used cautiously, especially during the first 3 months of pregnancy. After 3 months of pregnancy, it can be used, no association with any birth defects or any genetic abnormality or any neurodevelopmental abnormality for the baby from the studies and the research which we have done so far. So, as a summary, ultrasound usage is safe in pregnancy.